The ancient Gauja River Valley contains the town of Sigulda, which is also known as the Switzerland of Latvia. There we will find the most innovative radiosurgery center in Eastern Europe, which provides modern, effective, and painless treatment of prostate tumors. 60-year-old Andris visited his family doctor and submitted blood samples to test the presence of the level of the specific PSA antigen in his blood, finding that he was suffering from prostate cancer. 3 options were offered to Andris: surgery, watchful observation, or radiosurgery with CyberKnife M6. After consulting with a radiologist and therapist, Māris Mežeckis, at the Radiosurgery Centre of the Sigulda Hospital, Andris was told that he should undergo additional diagnosis at the Medvision Nuclear Medical Center. There, positron emission tomography and computer tomography technologies were used with PSMA gallium, precisely identifying the stage of the tumor and evaluating the trends of the disease. During the check, it was found that Andris not only had the primary prostate tumor, but also had the return of a third metastasis tumor in his pelvis and spine. The result was that the treatment tactics had to change. Radiologist and therapist Māris Mežeckis explained the results of the inspection to Andris, and despite the seriousness of the diagnosis, the recommendation was that he undergo radiosurgery to deal with the primary prostate tumor and the metastasis that had been found. Andris was told about the procedure. Given that the prostate moves in the pelvis because of smooth muscles and kidney activities, preparations for the procedure involve the placement of tiny gold seeds as markers in the prostate and the invaded lymph nodes. The procedure is similar to a biopsy, where a needle is stuck into the prostate to remove samples of the cells of the tumor. In this case, the needle is used to leave the gold markers near the prostate or the lymph node. These are needed to ensure the precise aiming of the rays so as to destroy the tumor. After the gold markers were inserted, Andris visited the Diomed clinic, where he underwent computer tomography and magnetic resonance examinations that were needed to prepare the therapeutic plan. These examinations are completely painless and take less than 2 hours. On the basis of the images, the radiologist and therapist works with a medical physicist to put together a radiosurgery plan so as to get rid of the tumor and its metastases. The plan is meant to protect surrounding organs and healthy tissues while delivering a totally destructive blow against the tumor. The Cyberknife procedure involves a high and precise dose of ionized rays which destroy cancerous cells in the prostate and the invaded lymph nodes, also destroying the metastasis of the tumor in the patient's spine. The Cyberknife Robot delivers the ionized beams on the basis of a specified schedule. The robotic arm can deliver the rays in as many as 1,200 angles, always taking into account the position of the tumor vis-à-vis the rest of the patient's body in real time. A single procedure involves an average of 250 beams, and it lasts 1 hour. The procedure is supervised by the radiologic therapist and the physicist, and the work is done by an assistant. The patient feels no pain or discomfort. The precision with which the tumor is destroyed means that there is hardly any trauma to the nerves and blood vessels that are in the prostate and are responsible for potency, so to speak. After the radiosurgery operation, most patients retain their sexual capacities, which are fully restored to sexually active men in 80 to 85% of cases. Radiosurgery may have certain side effects, such as a burning sensation while urinating. That usually ends a month or 2 after the therapy. The patient's daily life is not interrupted, and those who are around him won't even realize that the treatment is being done. The main benefit, of course, is life as such, but no less important is the quality of life after the procedure. Visit our homepage to submit a free request for treatment. Welcome.